So hi, everybody. This is Elisa Lapolt, and I'm the Policy and Advocacy Director for NAMI Tennessee. Thank you for being here. Let's see, I'm going to need to, let me just adjust something real quick here. There we go. Okay. So welcome. This is NAMI Tennessee's legislative briefing for the 2023 session of the Tennessee General Assembly. Thank you for being here. What we're going to be doing today is talking about those priority items that are pending before the legislature. We're going to be talking about the governor's budget recommendations as it relates to mental health, and also some bills that we're tracking, some bills that we've identified that are good and others not so good, that we wanted you as advocates to be aware of. The idea here is for this to be an informative session as we lead up to our March 1st Day on the Hill. And at the end of the presentation, I'll talk a little bit about that. So I'm going to ask you to hold your questions to the end. You can put them in the chat. And I'm going to ask Victoria, if there is a pertinent question about a slide, because I can't see the chat right now, if you could just let me know, and I would appreciate that. So again, as you're joining us, if you can put your name, organization, and where you live in the chat box, that would be great. So first, what we'll talk about today is Governor Lee's budget. So last week, the governor released his budget proposal to the Tennessee General Assembly. It's something that he does every year, and every year we keep our fingers crossed that there'll be some really great things in it about mental health. And during his administration, he's really done a lot in this area. This year, what he's proposing is a $9 million rate increase for mental health and substance abuse treatment providers. So these are the people, the therapists, psychiatrists, and the mental health providers that work within the state community mental health services through the Department of Mental Health and Substance Abuse Services. And then the second thing that is in the budget is $13 million for 6 new residential facilities for people with severe and persistent mental illness who are re-entering the community after incarceration. So what happens next is the governor's office will present this information to the various committees. The committees will have hearings on them, and then legislators can add to this budget proposal and come up with their own recommendations as well. So we're going to be tracking this information during the session. So as I was going through some of the bills that we collected, that we're looking at, that our lobbyist Bill Dobbins has been tracking, there was a couple of interesting things that came up. The things that we are tracking have to do with access to care and treatment with dignity. And you'll start to see that trend when I identify these bills. Okay. The bill filing deadline was earlier this month. And so what happens is once they're filed, we get to review them and look at them, and then they're already starting to be heard in committees. So we're going to start with Senate Bill 856 by Senator Bailey and House Bill 976 by Representative Garrett. This bill would extend workers' compensation benefits to firefighters with PTSD. And it's interesting because this bill, the way it's written, recognizes that firefighters have cumulative issues. You can imagine all the scenes that they are called to, the fires, the injuries, and deaths. It has a cumulative effect on their mental health and wellness. This bill recognizes this and says, hey, we need to extend workers' comp coverage to these people. And this piece of legislation was based on the 2020 suicide of a firefighter named Dustin Samples. He started suffering the having symptoms of PTSD and suicidal ideation back in 2014. He just couldn't get the coverage he needed, and he died by suicide in 2020. What ended up happening from that, and it's just very tragic because he left behind a wife and family. The firefighters in Tennessee came to Senator Bailey and said, "Will you do this bill for us?" And a lot of people have asked the question, why aren't police covered? Why aren't other first responders covered? And it's because the firefighters came to him. I spoke with his aide today, and she was explaining some of the background. Senator Bailey has publicly said that he'd be happy to expand this in the future to other first responders. But right now, it's limited to firefighters, and they're going to look at the cost. What they're trying to balance here is the cost and increased premiums for workers' compensation insurance versus getting firefighters the help they need, and then keeping them employed, keeping them healthy, keeping them on staff, because if not, you're going to have firefighters dropping out of their jobs. And we already know that there is a high suicide rate among firefighters, and getting them the help they need could actually keep them employed and keep the fire departments staffed. So that's going to be a really great bill and a really great area of study. Then the next bill is Senate Bill 376 by Senator Campbell and House Bill 446 by Representative Glenn. And this bill requires the State Department of Veteran Affairs to take several steps to help veterans with housing, with employment, with education, and specifically with health and mental health. With mental health in particular, it creates a health navigator program, a mental health navigator program. So people would be hired as mental health navigators to help veterans navigate the system. I mean, we all know how hard it is to find help and resources. And so also to help them maybe get resources from the federal VA or the local community. It also requires the Department of Veteran Affairs to seek grants and to work with other stakeholder groups like NAMI Tennessee to identify barriers to them getting help, overcoming the stigma, and then coming up with community-based approaches to helping veterans. Now, this bill on the House side, filed by Representative Glenn, he is new. He's one of, I guess, maybe 24 or so legislators who are brand new this year to the Tennessee General Assembly. Representative Glenn has, he's from Clarksville. He was in the Army for 23 years, had 3 tours of Afghanistan and Iraq, and then was stationed at the 101st Airborne Division in Clarksville. So now we have him as a legislator. And there's just a lot of promise in this bill, and really important for us to get behind it. So the next bill involving access to care is Senate Bill 866 by Senator Reeves and House Bill 827 by Representative Sparks. So this, if you were to look at this bill, it would not do what you think it's going to do, because it's filed in a way, it's called a caption bill, and it looks like it does one thing, but it's going to say another. And the reason is because they have to file bills by a certain deadline, and some of this language wasn't worked out. So they filed a bill dealing with just how to get help in a mental health treatment center, the call buttons. But that's going to be replaced with language that we hope will make it easier for hospitals to get people out of the emergency rooms, people in a mental health crisis, and into treatment beds. And Suzanne, can you talk a little bit about this? Because I know Suzanne Blackman's been working on this and working with NAMI Tennessee on this as well.
Yes, you explained that very well, Alyssa, and we appreciate Representative Sparks making room because he was full when Elliot approached him about it, but he felt strongly enough about it that he said he would make room. So this is, I'm assuming, how he made room was through this other bill. So the Tennessee uses a system called HERTS, the acronym HERTS, HRTS, for Health Resource Tracking System, and it's an electronic bed registry. And so psychiatric hospitals, well, all hospitals, acute care hospitals, even crisis stabilization units, they can list their bed availability through this system. And it's a statewide system, so even the public has access. They can go to the mental health portal and see what psychiatric beds are available at different facilities. But the problem is, although the state has been paying for this and it's been in place for quite some time, that a lot of hospitals aren't updating their bed availability. There's one I saw that last updated it in April of last year. So I've been working a lot on the issue of ED boarding. Well, part of the problem is people are boarded in the ED because they're on the waiting list for a bed at a psychiatric hospital. And so EDs, historically, what they've had to do is call around to different hospitals to find who has availability. Well, that's not very efficient. And they've got many other things they must deal with. And sorry about my phone. I forgot to silence it. So this will improve throughput through the EDs, or patient flow. And the language in this bill will make it mandatory for psychiatric hospitals to update the bed registry twice a day. So that way EDs can monitor it and have a realistic information, real-time information on what beds are available.
Great. Thank you so much, Suzanne. And we really appreciate your work on this.
Thank you.
So, and again, if you were to look at this online, these bills don't say what they're going to do quite yet, but stay tuned. It will be amended at some point. And we also want you to think about any time that maybe you or a family member, friend, or loved one has been taken to an emergency room in a mental health crisis. Maybe they've had to stay an hour, several hours, 12 hours, a day, 2 days, a week, until they get a bed. Okay, these are the kind of stories that we need for advocating for this bill. Okay, so we're going to talk a little bit more about how to advocate later. And we need stories to prove to legislators that this is a real thing that's happening and it needs to be fixed. So be thinking about stories that you can share. Okay. The next bill is, I call it second certification. And this is Senate Bill 672 and House Bill 105 by Representative Vaughn. So right now, our state law says that 2 physicians have to certify somebody in a hospital before they are able to be transferred into care or for a mental health evaluation diagnosis during a 72-hour period. Okay, so 2 people have to evaluate this person and sign off on the handover for more intense evaluation in this mental health crisis, and that process is called a certification. What's happening is hospitals don't have a lot of physicians who can do this. They don't have a lot of psychiatrists on staff. This bill would allow nurse practitioners and physician assistants, specifically with psychiatric certification or training, to sign off on this. But this bill is interesting because it only allows one person to sign off in a non-public hospital. So if it's a state hospital, 2 people have to evaluate the person and sign off on the certification, but in a state hospital or in private hospitals, only 1. So while we think that it's a good thing to let nurse practitioners and physician assistants help out with these 2 certifications, we do have some concerns about due process and we not having that second set of eyes on the patient before being certified. So, Bill, do you want to add anything for those who've just joined? Bill Dobbins is our lobbyist. And Jeff, if you're on, Jeff Layden, our executive director, just joined us as well. Jeff, if you have anything to add to this, you can jump in.
Well, sure, I will. I'll say, Elisa, you're doing a great job to go over the bills that we're interested in. It looks really good. You're explaining it really well, and it's great to see everybody here. And please invite who you can to look at the videos and to come to our Down the Hill on March 1st.
Okay, great. Thank you. Thank you. So again, we can entertain some questions at the end of the presentation. All right, so our next bills having to do with access to care are student ID cards. Now, you all might have remembered last year, the legislature passed a bill requiring that K through 12 schools put on, create the student ID cards for students in grades 6 through 12, and that they include information on the suicide crisis and mental health helplines. This bill, which is 350 by Senator Campbell and House Bill 294 by Freeman, requires colleges and universities to include the same information and contact information on student ID cards. Okay. So now we get into the sort of the second part of our theme for advocacy this year, which is treatment with dignity. Now, this is a piece of legislation that I've seen in other states, and it's quite archaic because in some parts of our law here in Tennessee, it literally refers to people with a mental health diagnosis or mental illness as a mental defective. Okay. And it also talks about treatment for a mental defect. And this is just very unfortunate language. It's old, it's outdated, and it perpetuates the stigma. So this bill by Senator Campbell and Representative Kyle would change the language in various parts of our laws to from a mental defective to a person with a mental health condition. Seems pretty straightforward, like a no-brainer. But what ends up happening in this kind of a bill is it does take a lot of work to go through all the pages in the books called Tennessee Code Annotated and change this. And a bill like this sometimes gets put down lower on the priority list when you're talking about other bills dealing with, funding for foster care or, so many other things. So it's just something that we wanted to bring to your attention because the language is really obnoxious and it's just wrong. And I think it's time that we start talking about this and promoting a change in the law books. Also, treatment with dignity. This is a very troubling bill. This bill, Senate Bill 141 by Watson and House Bill 127 by Representative Martin, allows certain school personnel to use mechanical restraints, like the one in this picture, on students receiving special education services. Okay. So right now in Tennessee law, this is prohibited. You cannot use any kind of restraints, a mechanical restraint on a student who receives special education services. And when we talk about mechanical restraints, it's anything that restrains them. It could be handcuffs. It could be like straps. It could be a type of life preserver looking thing that, I don't want to say straitjacket because that has a lot of mental connotations there, but they would be strapped down like in this seat. And I've seen there was actually a bill very similar to this passed in Florida just last year, and it would allow like I said, certain personnel, and I'm going to get the list here. Specifically school resource officers, school security officers, or any other law enforcement officer to do this, but they have to be trained and certified for completing a behavioral intervention training program. So they do have to be trained in how to do this, but you know, do we really want this if somebody's in a mental health crisis? And you know, our answer would be no. So again, we can talk more about this at the end of the presentation. Another very troubling bill is Senate Bill 1334 by Senator Bailey, House Bill 1192 by Representative Williams. Now, you may remember last year there was legislation that was passed that essentially criminalized being homeless, and it made it a misdemeanor and eventually a felony for repeated offenses if you are homeless and you're camping on state property, a state park, side of the road, side of a state road. And we felt like it didn't do anything to solve the problem, to get people the help they needed. Well, this bill, while it might be well intended, is very concerning to us. So this legislation creates state sanctioned camps for homeless individuals. Where we're concerned is that it actually allows for the involuntary commitment of individuals, even if they're in what's called remission from mental illness. So, you know, we're still digging into this and what the intention is, but right now we find this to be very, very troubling. Okay. So that's just a highlight of the bills that we're looking at. There's probably another 40 bills that we're tracking, dealing with all sorts of different things. Some might move, you know, some might be heard in committee, some might not even go anywhere, but this is where our focus is going to be. Now, next week, I'm going to be teaching people how to contact legislators and tell their stories very effectively. If there's a piece of legislation that I've talked about today that concerns you, that gets you fired up, please join us next week. And I'm going to talk with you about how to take that passion and your lived experience with mental illness and make it into a story that can influence a legislator into voting either for a bill that we want or against a bill that we don't want. Our day on the Hill is going to be March 1st. And there's signups on that. If you go to our NAMI Tennessee website, namitn.org, go to our advocacy page and you can sign up there. It's free. If you come to our day on the Hill, you'll hear from Commissioner Marie Williams from the Tennessee Department of Mental Health and Substance Abuse Services. And you'll get a free lunch. And it's going to be in the Capitol this year on the second floor, right across from I think it's the Senate chambers. And finally, if you want to be part of our advocacy efforts, you can text us. This is something new that we're going to be doing. We're going to be doing text alerts, our advocacy alerts by text. You can text NAMI TN to 82608. Okay. Promise not to bombard you. We're just going to do it in really critical votes. Right before a vote, we'll send out the alert and ask you to contact your legislator to either vote for or against the bill. And I'll have the wording, what to say, who to send it to. And then if you just text that to 82608, the first thing you'll do is sign up to receive the text message advocacy alerts. And then finally, you can contact me directly at alapolt@namitn.org. So that's just a quick overview, and I wanted to see if there are any questions or comments. So Brandy said, did you say one of the bills requires contact info to be put on student IDs for 12th grade or just college students? So the answer to that, Brandy, is there's already a law that was passed last year that requires the student IDs for grades 6 through 12 to have that information. this bill this year would extend that, would expand it to college students. Okay. Oh, and thanks, Tom, for the link to advocacy days. So I wanted to hear from the group. What did you think about the homeless bill, about the creating the homeless camps? And you can just unmute, talk.
Okay, homeless camps. That's horrible. To me, it's sweeping them under the rug. We need to build more long-term facilities. We have done that for Alzheimer patients. They're difficult to care for after some time, and we've built long-term memory facilities. I don't know how much the government's involved in that, but that's what we need for some of these chronic mentally ill patients. 70%, I'm sure, or more of the homeless are mentally chronically ill. They're just not treatable for some reason.
Mm-hmm.
So throwing them into camps on the streets, that doesn't sound right.
Mm-hmm. The other, thank you, Sue. The other thing that I find troubling in the bill is that this would be run through the Tennessee Housing Development Authority, THDA, and the state would have no liability unless it's gross negligence. And so, what happens if somebody's injured? I don't think it puts THDA in a good position, quite frankly.
That's a good point. It's totally unsupervised then.
Right. And what about health department inspections? What about?
Yeah.
There's just a lot. So Jarvis, you had your hand up. Where did
you? There's not much to say about it. It's just awful, an awful idea, and it's a lazy idea, honestly. So yeah, that's all I had.
Yeah.
And,
Tom?
and I was just going to share, these are very educated, good people that are trying to come up with good ideas. I'm sure they're thinking, we don't want people to be a harm to themselves or others, so we will restrain them in schools or we'll put them in camps. And saying it out loud, it feels terrible, but you have to understand that somebody gave them this idea saying this would work, and they may not understand the harm they're doing, or the risks that are involved with such frankly a terrible idea. So just remember, as you confront some of these legislators, these may be your legislators who are submitting these bills, we still need to be respectful and understand that they're just uneducated. They're probably great about insurance and about mortgages, but they don't have any education in mental illness and mental health. And we'll have to be very patient and respectful about these not so great ideas they have.
Mm-hmm. Thank you, Tom. And if you notice, when I was explaining it, I didn't say anything about the legislator. My comments were focused on the piece of legislation, because the person who has a bill you don't like today might be the person who helps you on another one tomorrow. So the bill for the homelessness camps is filed by Senator Paul Bailey. Well, guess what? He's also the sponsor of the firefighters bill. So you can see where this legislation just needs some fine tuning. So it's well intended.
I have a question. So when we talk about for these bills, especially this homeless one, do they have any evidence behind what they came up with? And is there any way we can know how, why, who decided that this was a good idea? And there's probably some kind of rationale behind it. And how can we know more about it?
A lot of times that information comes out in the committee meetings when there's a hearing on the bill. Like the bill sponsor will say, well, I'm doing this because, or this organization brought me this bill, and here's here are my thoughts. And then other legislators ask questions. And you can actually watch those bills online if you go to the tn.gov website. So
So do we know about this one, like for the homeless
Um,
camp one specifically?
so this was a result of legislation passed last year that I mentioned earlier about the
Yeah.
criminalization of the homeless on
Mhm.
the camping. And Bill and Jeff, you guys were more involved than I was last year on that bill. What was the background? Because I think it came from some individuals in Cookville.
Correct. There was some homeless folks who were panhandling at the exits on I-40 in Cookville, and some of these legislators thought that was a good look for their community, and so that's that. And also, we have found that the source of this legislation is out of a kind of a think tank organization out of Texas called the Cicero Institute organization. They had the criminalization of the homeless bill last year, and apparently they are the source for the homeless encampments bill for this year. So, and I think it has passed in 2 or 3 states already. I can't remember which ones. But that apparently is the source of the legislation is this Cicero Institute out of Texas.
Mhm. Bill, isn't there something in this bill that would make it harder for us to get federal housing money?
There is some language that I don't believe the sponsor was aware, and you're exactly right, Jeff. It would hamper, if not jeopardize, the state of Tennessee's ability to access federal housing dollars. So right now, the sponsors have been made aware of that, and they're looking at trying to amend the bill in some way in order to alleviate that section of the bill. But we haven't seen any changes yet, and it's not on calendar yet either. So we'll be in contact with the sponsor to determine what the new amended bill might look like.
Okay. And I'm going to call on Jana. John. Jana is one of our NAMI Tennessee board members, and she's been working on some potential solutions. And I don't know if you're able to share, if you want to comment on this particular bill, Jana, but I wanted to just let you chime in.
Well, my dog spoke up. I don't know if you could hear that, but that's one of the reasons I've had you. Oh dear, this may not work. I guess my concern would be the devil is in the details. Is it even possible to set up something more like a refugee camp, for example, that is, it could be potentially well run? What would that cost? But the real question are the camps, a lot of times they end up being doorways to nowhere. I mean, they don't solve anyone's problem. How do they lead to getting someone into housing? What sort of accountability is built into the model? So the legislation is worrisome from many different perspectives. It almost reads like the goal is to, I hate to put it this way, but it's like, rounding up people on the street and putting them somewhere so we don't have to see them is sort of the sentiment that I take away from it. On the other side of the coin, we have been talking to the governor and the Speaker of the House about potentially putting some money into the budget for supportive housing, which, research shows is very effective for people with severe and persistent mental illness experiencing homelessness. that is a solution, that works, and it is evidence-based, and we don't have enough of it in Tennessee. So I don't know how this story is going to play out, because it's almost like it feels, it feels a bit like completely different strategies to deal with the issue. I hate the idea of camps, but I'm trying to open up my mind to the possibility of, well, if we're going to have camps, if this is going to happen in communities, because there seems to be a lot of momentum around the idea, then let's make sure there are camps that work well and actually lead to solving the problem for people, that lead to permanent housing and help them get out of homelessness. So I guess those are just some of the thoughts circulating in my head right now.
Thank you. Thank you. Appreciate those comments. Charity, you had your hand up.
Yes, I kind of wanted to expand on sort of what Jana was saying. Obviously there needs to be something done about the homeless issue, but treating it like a problem and putting them in camps seems to be like it would be a move in the wrong direction, just because of what that might entail after some time. And especially with, as you said, I believe that anyone could be hospitalized at any point, correct? So I don't see that the camps would even be, unless they are forced into these camps, which of course, since homelessness is now illegal, essentially. But my question is it better to oppose something like this, where I feel like the legislation is pushing more towards not necessarily helping the homeless, but removing the homeless from where they are? Is it better to push for additional legislation down the road, or would putting a temporary Band-Aid on this make it harder in the long run?
So first of all, yes, I think it would be appropriate to oppose this. Our NAMI Tennessee Board of Directors, as a matter of fact, is going to be looking at these issues the next couple of days. And so to answer your question, there's two things we can do. We can oppose it, and we can advocate for more funding for services for the homeless. So there's a lot of different strategies that we can take here, but we definitely want to send the message to legislators that this isn't the way to do this, that it is a Band-Aid, and yeah, like Charity just said, long-term fixes. Yeah.
I want to say something here too, that about last year. I watched some of those hearings, and there's a belief, according to the people that testified in support of the bill that criminalized the sleeping outside in certain areas, that folks did not want to get help. And there were some statements made that we have help for these people, we have services, why aren't they using them? Which gives the idea that people can't decide for themselves, and there's help right there and they just won't take it, as opposed to kind of learning why some people would prefer not to use shelters and other services. For example, they may not feel safe there. So what is going on really? And I think that when you don't get the advocates together and that really know, and people working and hearing some voices from people with the issue, that it's tough to know what the solutions are. But I think that clearly there's issues with some of what we have also, which now we get into this paternalistic, coercive kind of response. And I would like to see like buildings retrofitted if we have empty buildings in certain regions around the state, and have supportive services in there. Sounds better. That's shown to work under Housing First. So just wanted to kind of lay that out there. It's like, why don't people want the help that's available? Well, Let's ask them.
Yeah, thank you, Jeff.
Yeah, could I say something really quick? Greenhouse Ministries in Murfreesboro, I believe, has some housing, and I know there's a shelter there also, a women's shelter. I think also there may be 2 shelters, and I think they are pretty well utilized. So I think a lot of people in need of housing are using these services. There's just not enough of them.
Yeah, this was just a view of certain legislators when they were saying, it was kind of put out there as this is a way to, we don't really want to put them in jail. We want them to use the services that are available. So here's a kind of a stick to go with that. I kind of heard that. And we also need more longer term housing solutions and not just shelters and people to bridge into permanent housing. And so that's probably more of a gap, I would say. When people aren't on TennCare as well, like Bill, maybe you can answer this. TennCare covers some homeless services and has contracts and pays for some housing, but I don't know that we're sitting with a lot of empty beds through that.
Not that I am aware. It's again, it's, I think the idea that Suzanne mentioned about the governor having an interest and the speaker having an interest in developing a permanent housing. This is what Jana referred to earlier. I think is a more proactive approach that I think we as an organization can emphasize and really rally behind, saying this is a better option than what this bill is, and certainly give legislators a choice, saying here's something that is permanent, that can really provide long-term solutions than just these temporary homeless camps.
Marta, I want to get to Marta because she's had her hand up for a while, and Marta is also one of our NAMI Tennessee board members.
Yes, I can attest to that. The reason why when I got homeless, I didn't want to go to a homeless shelter. It was because, first of all, the location of the place was not in a good location. That was in New York, and also the violence in the place that I was going to stay. So I preferred to stay in my car for about 3 days until I decided to move to Tennessee, because I didn't want it to go to a place where I was going to be violated or something was going to happen to me. So that would be my my experience with it. But then the question is how, I know that these meetings are done. I don't know where they get all the information that they get before they make these bills, but what I can do, what can I do as someone that is now coming to these classes and I'm trying to learn more about advocacy? What can I do? How can I get more involved, or how can I get more about these meetings where I can be, like Jeff said, he goes to these meetings sometimes and he hears, how can I get more involved in these meetings so that I can either talk to other people about what they're trying to do or what they're planning or things like that. And then I can run the voice and tell other people, hey, this is what's going on. Do you want to participate in this meeting so that we can fight this? You know? I'm sorry, that was a long question, but.
No, I appreciate it. So what I do is send out advocacy alerts. If a bill is coming up that we need a full court press on, to let people know to contact their legislators. Sometimes it's before a committee meeting. We can try to get a bill killed before it goes to a committee meeting. Sometimes it just keeps rolling, and we've got to, when the bill goes to the floor, that means it's the full House or the full Senate. We've got to really bombard them with calls and emails. And yeah, so I will let you all know with advocacy alerts. And then, like I mentioned earlier, I'm trying to build this advocacy alert system by text. And I'll put that number again. It's, if you type 82608 and then put NAMI TN in the subject line, then you can sign up to get advocacy alerts from us.
One other thing I would like to mention is it's got to do with the amount of time that people have, because there's many opportunities to learn and hear from people. So many communities have homeless coalitions, and a NAMI person can go there and say, I'm part of NAMI. I'd like to be involved with your coalition, because we know that some of the people that are homeless have mental illness. So it's like the regional policy and planning councils that many of you that I see here have attended policy and planning councils, and the local ones talk about housing all the time, and they put it in their needs assessment. But we're not always at every table, and we may not get invited, but we may want to request permission to enter. And so I think a lot of cities have community groups that are looking at homelessness, because it's not just our issue, but it's an important issue to NAMI, because a lot of folks that end up homeless have mental illness for sure. And this is why I really promote, and I'm going too long, I'm sorry, but family member education and support, caregiver education, to me is something that we can do to try and put a dent into this problem, because so often you hear people have burned the bridges with their family. And if we can get a little bit more understanding of what is mental illness and the family's role and how they can be a help, they may not want their loved ones still to live with them, but they can at least be part of a support system and have people not totally on their own. And where I mean, the homeless people, I've talked to many of them, different places, and done volunteering and all kind of things with feeding and what have you in Tennessee and elsewhere. And those folks have family, most all of them, not everyone, but their parents could be gone and they never had a spouse, never had children, no siblings, but folks have family. And if the caregivers can get a little more education and support, it'll help. And then, when somebody leaves, when they're vulnerable, they don't know how to care for themselves, then they can end up homeless. And we have a real issue there with transition age youth, for example, that have been in the foster care system, and then they're adults, and then they're out, and they're, folks that aren't ready to take care of themselves, and then they're out on their own, asking for trouble many times.
Mhm. Anyway. And thank you, Jeff. Well, we're getting close to the top of the hour. I wanted to see if there's any last minute questions. And again, feel free to contact me at my email, alapolt@namitn.org.
This is a random question. It'll seem random, but I like to read literature. So I'm new to this advocacy thing, and this is one of my goals for this year, is to begin to be more active in this way. Is there any literature that you all would recommend for me to take in, just fundamentals or foundations of advocacy, just to get a better understanding of how to start? Because I've been through a lot of stuff, and I've got a lot of things that I want to advocate for and against or whatever. I just want to know how to start and how to do it right and be effective doing it.
So yes, I can actually tell you that I have developed a toolkit for NAMI Tennessee that explains how to talk with your legislators, what to say, what not to say, a sample letter. And we just posted that today on our website under the advocacy section. So you can use that as a guide, but also you can join us next week, February 22nd, because we're going to walk through, like we did last week on the 988 webinar, walk through how to reach out to your legislators, how to get an appointment, and then what to say when you talk with them. We will be asking people to make their own appointments if they register for Day on the Hill. I can help with that, certainly. But so yeah, going through the toolkit would be helpful for you. In fact, let me see if I can find it and I can post it online. So are there any other questions?
Oh yeah, sorry, I do have one. So I said in the chat, but earlier when we talked about the bill with like the student ID on college students, the college student IDs, does that include electronic IDs or is it just physical? Because now at Vanderbilt, most students use electronic ones, and we do have a physical one that has like, I think the crisis like lines on it, but our electronic ones on our like phones, or like some of them have Apple Watches, like we don't necessarily have that anymore. So I'm just wondering if it's included.
I didn't see anything in there about electronic. I think it's like the printed cards. It's just, you know, a resource for the students.
That's good. Thank you.
Yeah. And I'm glad you're here. You said you're from Vanderbilt. So, you know, thank you for being here.
Yeah, I'm just really interested. This was very informative. Thank you guys so much.
Good. Get your friends to get involved.
Yes. There are a lot of college students here that are very interested in advocacy. I don't think they necessarily know what's going on and how to do it. I'm also like, I just found out that this exists, so I'm very excited to join, and I'll definitely let them know.
Okay, great. There's also like a NAMI Davidson County chapter, which
Yeah.
is on there, and then we're the state organization. So yeah.
Yes.
In the chat box, I just put a link to the toolkit, so you can click on that, download it, read it at your leisure. And Charity, you had another question.
Yeah, I just had a question really quick about State Bill 866. I was curious, this may be for Suzanne actually, but what sort of barriers are there right now from these hospitals implementing? I know you said some of it might have been technical issues and things like that nature, but is this likely to cause any issue for forcing these hospitals to switch, making it mandatory? I just, because of the issue right now with getting into hospitals, I'm just concerned about that making it worse. I know in the long run, it's definitely going to be a good thing, but just to surmise, what are the issues right now that are just, you know, making that a problem?
I can actually answer part of that, and Suzanne, if you want to jump in also. One of the theories is that the reason that the hospitals aren't updating the online information is because they don't have the staff to treat the people if they come into the treatment center or the facility. That's one thing I've heard. You know, we're still trying to collect stories on what's going on and hearing from people. Suzanne, do you want to add to that?
Well, I'm glad that you were able to, you know, get that information, because I didn't really know the reason they weren't updating regularly. As for just the updating process, in my opinion, it would not create a burden on hospitals to update the registry. I've seen the training videos and it appears to be very user friendly, and that they could update it. It seems like to me it would take maybe 5 minutes to update it. And it will list different types of beds based on demographics, adolescent beds, geriatric beds, adult beds. And so, I mean, there is breaking it down according to that, listing the number of beds available. But a lot of the information, once it's entered, that won't change. What will change is the bed availability and specific number of beds available. So, I mean, I do realize that I'm not in their world, and I don't know what it's like day to day at their jobs, but the system, Hertz, appears to be very user friendly. So now the staffing issue, that's something that hospitals will need to, I guess, work on at their individual sites to make sure that they have the proper ratio, provider to patient ratio. So that's yet a whole other issue, I guess, to tackle.
Mm-hmm. Definitely.
I'd like to give a commercial here for 988, and the reason is that if we can help people get into treatment earlier before they need to be in the hospital, it kind of helps everything, because when folks go into the hospital, it's traumatic, and sometimes it's necessary, but it's it's a difficult, challenging situation, and then you're stabilized and you're out. The lengths of stay is very short. In an inpatient stay, like below a week, I would imagine now is the average. I haven't seen the data for a while, but 5, 6, 7 days. So with the point of 988 is if there's a crisis, you get to talk to a trained mental health person instead of law enforcement coming to you and taking you into an emergency room and waiting to find a bed. And I saw a report yesterday that only 3%, I think it was 3% of the calls required an emergency response, and 4% of the calls got referred to mobile crisis, and 93% of the calls to 988 were dealt with through the triage and referral to community resources and other things like that. So when people call 911, it's going to be police usually coming, unless we have co-response, which we have a little bit of, or a non-law enforcement response, which is beginning in Nashville. So for 95% of the calls, it's going to be law enforcement, and they get training, and we're working with that, and it's better. But law enforcement doesn't have a lot of options other than leave you or take you somewhere. And if they take you somewhere, it's a walk-in center or it's a jail. I mean, not a jail, walk-in center or an emergency room. So calling 988 for mental health crisis is the way to go. And it's pretty new, and we need to make noise about it, in my opinion. I think that will also help.
Great.
Can I share something about 988?
Sure.
I shared with someone that I was going to go to the Day on the Hill, and that we were gonna, this was one of the bills that we were gonna talk to the senators about and all that. And the person had a bad experience with 988, and she blasted on Facebook, and a lot of people were commenting, and they were saying that they had the same negative experience. One of the people that answered the text, I think it was a text, and she shared the text and everything, was not very supportive, and the person kind of hung up, like just let her like in the cloud, let's put it that way. And she was very emotional, and she was like, I needed help, and I'm already very depressed, and what could have happened to me, and all of that. And I was trying to kind of tell her, that was one apple in like a big basket. And I would encourage you not to judge all of the 988 calls with that one. But she was and there were other people like commenting that they had the same experience. Now, this was not in Tennessee. This is in California. So I told her, maybe the location is different, people are different, but I have heard that this has helped a lot of people. So I was sharing that. What can I do? Besides what I already did, tell her that, everybody's experience is different, to kind of encouraging her, because she has a voice. She's a person that's recognized, and she had a voice up there. And my concern is that she would use that voice to do something against the bill.
You've done a lot already to mention one, that when you talk about it in Tennessee, it's nice that you say it didn't happen in Tennessee. But more importantly, as an advocacy organization, if something like this happened in Tennessee and somebody has these texts and they can show it to us, we can share it with the leaders of 988, which Elisa has been in touch just in the last week with Jennifer Armstrong, who sits on top of this. So NAMI, we have a Department of Mental Health here, which the department is responsible for 988 rollout, that says we don't want to just hear complaining. We want opportunities to improve. And if there's evidence of things that did not go well, they want to hear about it. And we've told them about back when Suzanne and I began talking, before you got all energized here, you'd called me about a case, and I involved the department. I don't know if they helped or not, or if it was quick enough, but I'm like, here's an example. Someone's in an ER, they're getting stuck. It's a terrible situation. I called them, And the commissioner has told us, don't just go talking about it, give us a chance to improve. And so some secondhand things is hard, but if there's like, if somebody will say who they are and here's my experience, and they share that, we could help that get to the right place where it could make a difference.
Thank you.
Right. All right. Well, thank you all for attending. Hope this has been informative. Hope it's inspired you to get involved with some legislation. Join us next week as we learn how to talk to legislators and tell our stories. And if you can't attend, you can find the recording probably within 24 hours on our website. So thanks again and have a great evening. Bye.
Lisa, do you have a minute when everybody leaves?
I do.
All right.
Okay.
Thank you,
Thanks.
Bill. Thank you for being here too.